I'm so clumsy.
Hi, my name is Michelle Walker, and I'm going to be doing an IV insertion today and doing a IV push with medication, as well as administering IV fluids after that. Our patient today is Mr. Banana, and we are going to start off with the 12 steps. I'm going to verify the patient and the order. I'm going to perform good hand hygiene before and after patient care. I'm going to verify facility policy on the procedure that I'm going to be performing. We are going to follow any manufacturer recommendations of any equipment that may be used in this procedure. And I'm going to knock on the door. I'm going to identify my patient with 2 identifiers, do an overall assessment of my patient, overall well-being of my patient, provide privacy, and I'm going to explain the procedure to my patient, and then I'm going to raise the bed up for good body mechanics, dons any PPE that's necessary, and then upon completion of the procedure, I'm going to lower the bed, raise the bedside rails if indicated on the patient's care plan, and then also make sure that the call light is within reach of the client. Any abnormal findings, I make sure that I report those right away to the charge nurse. We are going to be pushing morphine 2 milligrams today. It's already pre-drawn up. I cross-referenced that with the drug book. Morphine is opiate, so we're looking for monitoring the vitals closely, especially the respirations, because it can cause respiration depression, as well as decreasing altering the depth of respirations. It can cause cardiac arrest, so you just want to make sure that you're assessing that, as well as their bowel sounds, because it can cause decreased bowel movements, constipation, as well as retention in your urine. So we also want to monitor the in and out put of the patient's urine. You're going to be assessing the patient 30 minutes to an hour after you insert the IV. Make sure you report that in your documentation. And I also, since we're administering 0.9% normal saline after we do the IV push, I have cross-referenced for compatibilities for the fluids and the medication that we're pushing today. I've already primed and prepped my IV fluids. Make sure there's no air bubbles in there, making sure it's a sterile technique, and that's hung and ready to go. I have my normal saline here that I have gotten all the air bubbles out, primed and prepped here. And let's see here. I need my tourniquet here. And you also want to make sure that you have double checked with not only the IV medication, but your saline fluids, the fluids that you're using. You have double checked, triple checked the order, and the Mars and the Cardex as well, and making sure that you have everything at the right dose. And I have also, per the order, we're giving 150 mLs per hour of the normal saline. And so you want to go ahead before doing the IV insertion, make sure that you have your infusion rate, which when I calculated it, because we're doing over an 8-hour period, but it's 150 mLs per hour, and that goes down to about 25 drips per minute. So that's all ready to go as well. I'm going to don my PE, which is the gloves. And you want to make sure that when you're choosing an arm, that you're not choosing one that has any comorbidities. Making sure that you're choosing the non-dominant hand, making sure that there's no, it wasn't a previous arm that has some infiltration used or anything like that, or infiltration happening and that there's no open wounds or anything. And I'm going to be using the basilic vein on the patient, and we're going to be using their right arm, forearm. And I'm going to take my tourniquet. Now I'm going to make sure that my tape is ready to go. I'm going to place the tourniquet 2 to 3 inches above the IV site. With a quick release knot here. I'm going to palpate gently here. So I've got my vein. I want to release the tourniquet. And I've already made sure that they don't have any drug allergies to any skin prep. So I'm going to move outward in a circular motion. And then reapply the tourniquet. Make sure that that dries. And you're going to take your catheter here, making sure that the bevel is up. You want to go ahead and anchor your vein. At about a 10 to 15 degree angle. You're going to gently glide in. And once you see blood return, make sure the vein stays anchored. Once you see the flashback, you can go ahead and insert the catheter. And gently pull back. And using the safety mechanism, clicks, I would place this in the sharps container. Now, making sure that you keep pressure on the vein so that there's no spillage of the blood, you're going to take your saline flush and attach it. Release my tourniquet. I'm going to check the placement for patency. And there it is. Good. You're going to go ahead and flush, and the vein is patent, so we know we have a good placement. I'm going to take my tape here and anchor the catheter. Putting pressure above. I'm going to now attach my 2 milligrams of morphine push here. And I pretend I have the 2 milligrams that's already been drawn up. I would go ahead and push that medication, and then using sterile technique and making sure you're alcoholing the top, making sure that you're not cross-contaminating, and then I would place my IV line on top of it afterwards. And I would have my already labeled Tegaderm with my name, date, my initials, date, and time. I would go ahead and place that on to secure my IV site, and make sure I note the overall condition of the IV site, how the patient tolerated it. I would document which vein I would use, the date, time, all of that, as well as any patient family teaching that would be involved. And then, of course, you also want to document when you reassess your patient, along with those respirations. You want to make sure that you document all that once you have reassessed your patient. And that's it.